Good morning, everyone. So, I have already made two videos on the spotters and the grandviva, and it is the continuation of that series only. And I am trying more and more spotters to include in this video so that it will be very helpful in your microbiology practical exam. So, let's start without wasting time. So, you can see this spot, and I think everyone is able to identify it. So this is the sterile container. So if the container is like it is given you in a packed condition, so it is a sterile container. If it is like this, where there is no packing is there, so you can say it is a it is for collection of the sample container for collecting the sample. Now, all samples you can collect here. So it can be useful for collecting the stool sample or urine sample. So then they can ask you about the, if you are telling about the urine sample, they can ask what instructions you will give to the patient by collecting the urine sample. Like you have to tell about the midstream clean catch. That is a technique which we have to follow by collecting the urine sample. They can go in detail uh, about the UTI. So related to that, they can move. If you are saying about the stool sample, so they can ask you how you can process the stool sample, what are the medias you can use for processing the stool sample, how you process if the sample comes to you. So you can tell about the like stool examination, about the macroscopic examination, microscopic. You are making the mounts like the saline mount, iodine mount. Then they can go to the various parasites which you can see when you do the stool examination. Now the plates which you can use for culturing these bacteria, so you have the um, XLD, DCA and the McConkey agar. If specifically you go for the Vibrio cholera, then you have the bile salt agar. Then if you go for the selective media, then it is the TCBS. So depending upon what answer you are giving, so the question will be according to that topic. So now we come to the second spot. This you can see. So you are noticing here there are a set of tubes are there. In one you are seeing noticing the blue color, and there are three sets more that is of pink color. So this is the Vidal test, and this test basically is being done for the salmonella type, that is the salmonella mean, that is when you are detecting the typhoid disease or enteric fever. So we usually many of the clinicians write for this Vidal test. Now what is this Vidal test? This is a tube agglutination method for detecting the antibodies against the salmonella. So basically you are trying to detect that if the patient is having disease of salmonella, that is enteric fever, any species, whether it is typhi, paratyphi A, paratyphi B. So you can detect the antibodies. If the person has got the infection, so the antibody must have been prepared in the body, and you are detecting artificially in the tubes antibodies. Now one series is that one row of tubes is of blue color antigen is there, and three are of pink. So this blue one is TO, and this pink one is TH, AH, BH. Actually we are detecting the O antigen and the H antigen. So we are detecting antibody against the O antigen and the antibodies against the H antigen. O antibody formed against the O antigen is non-specific. So whether it is Salmonella typhi or paratyphi A or paratyphi B, so they all have the same O antigen. Therefore, we are putting only one row of this O antibody testing. Whereas the H antigen is where the H antigen is specific. So if it is typhi, so you are putting one row of this is TH and two rows for the paratyphi A and paratyphi B. So any of these, and then you will notice like you have taken the patient sample, and you have added the antigen and you have put in the water bath. So next day you will see whether the antigen antibody reaction has been taken place, so that you can notice the agglutination. So in the O1 you will notice the chalk clumps will be, you will noticing. So, and if there is no reaction, so you will notice a blue button. Similarly in the pink one also you will notice that there will be some cotton like agglutination you will notice. So you will notice that you will measure up to which tube or up to which titer the agglutination has been noticed. So on that basis we give the reading of the agglutination in the O and the H. So depending upon a zone or the area where you are doing this test, so you can say that if the titer is going above this for the TO, or if it is going for the H above this, then you can say that the test is positive. Usually we do not give positive results on the basis of single test. If we are noticing any positive result, we will ask the patient to come after 2 weeks and then you again put up the test. If you are noticing the rise in the titer or the fall in the titer, then you can say it is a confirmatory test that the person has the typhoid. So that is all for the Vidal test. There is a very detailed, many questions can be asked in the Vidal test. What can be the false positive? What can be the false negative? So all that you have to read in the theory only. So I can only clear the basic point for this Vidal test. Now this is the microtiter plate. You must have seen in your classes. So this is basically we are using for the ELISA. That is the enzyme linked immunosorbent assay. So this is a microtiter plate. This is used for ELISA. What is ELISA? Enzyme linked immunosorbent assay. And where we are using this ELISA, so they can ask about the ELISA. Different type of ELISA like direct, indirect, sandwich, competitive. They can ask any of the ELISA in detail from you. Their favorite is the sandwich ELISA, is also indirect, which is the most common ELISA being used in the labs. That is the indirect ELISA being preferred, and it is easy because the kits are being used by the departments. So they can ask about what are the steps for ELISA and what is the indirect ELISA. Then how you can, what are the uses of ELISA. So in various tests, like you have this dengue test, you have the chikungunya, you have hepatitis B, C, so HIV, everywhere we are using this ELISA. Usually the rapid tests which are giving the positive result are to be confirmed by the ELISA test. Now how you can sterilize this microtiter plate? So that is it is being sterilized by the ethynyl oxide. So that is a favorite question, how to sterilize the microtiter plate. Now we come to the next spot. So this is Petri dish. So whenever your examiner provide you Petri dish, kindly take up the Petri dish and check what's the material. So if it is a glass Petri dish or if it is a plastic Petri dish. Usually the plastic Petri dish are the disposable Petri dish. We cannot reuse it. But if most of the labs which are the old institute, they are preferred for the glass Petri dish because you can reuse and you don't have to waste your resources. So this is a glass Petri dish and you can, so what is the next question? How you can sterilize it? If it is a glass thing, always, wherever in the exam, viva, if anything is made up of glass material, you can sterilize it with the hot air oven. Now if you are saying hot air oven, they can ask about you the hot air oven temperature condition for what is the time for which you have to sterilize it and what is the temperature. So sterilization topic should be memorized by you by heart. So all the autoclave, hot air oven, everything, temperature, pressure, all you must know. Now if it is glass petri, what is the use of this petri dish? So that is for pouring the media. So whenever you are making the plates, you are pouring those medias, any media, blood agar mein kaun ki agar, so that you can pour in into this and you will leave it there. It will solidify and then you can use it. So there are multiple questions what can be asked. like you have poured it, what are the conditions you should follow there, that it should that the whatever you are pouring, it should remain sterilized. So, and what, how you can check whether your media which has been prepared, whether it is sterile or not. So you simply put whatever lot you are preparing, you have to put single plate in the incubator, and next day after 18 hours you can check if there is any growth without inoculating any sample, then your media is not good. So you have, usually we say that whenever you are pouring, it should be in a separate room should be there for making the medias, and it should be in the laminar flow, and also the flame should be there because it will sterilize the surrounding environment. So all these rules should be followed whenever you are preparing the medias. Now we come to the next slide. So this is already I have mentioned here, this is the 3 ml glass pipette. Sometimes they can also give you that, and if you have not seen, you will not able to utter a single word about that. So this is a glass pipette, and initially we were using these glass pipettes only, whatever serological practicals we used to do, either in the MBBS or in the MD, we used to do, we have to prepare, like I have shown you the Vidal test, we do with the help of these pipettes only. So whatever amount you are taking of serum or any fluid, so you have to, if you want to take a measured amount, like you want to take 1 ml, you want to take, so it depends. So you can use these pipettes for taking a measured amount of the any solution. So that can be asked, what is this and what is the use of this. Now the next, so this is the, that you must have seen. So this is the latest pipettes which we are using. So this is the automatic pipette. Here also we can take the measured amount of any liquid, like in COVID testing we are doing, in the molecular labs we are doing. So there you have to take a very small amount in the PCR labs. So that is not possible with the glass pipettes. That is a disadvantage, and also it is very precise. In the case of the glass pipette, it's not so precise because you are doing it manually. But here you set the limits, and you can take either it's 1 ml, it's 2 ml, not the big amount, but also a very small amount in the microliters. Like you want to take 10 microliter or 1 microliter. So that you can set different range. Automatic pipettes are coming and they are very easy to use. So that is the automatic pipette. So that's all for the today's video, and soon I will make, there are many spots have been left, so I will cover in the next video also. Thank you for paying attention. Thank you.